A constituent contacted me last week whose daughter works in a care home in the north of Scotland. She recently processed the arrival of a resident who'd been transferred from the Home Farm care home on Skye to that home. That resident then subsequently died of COVID-19 within a week. So can I ask the Cabinet Secretary, how widespread is the transfer of residents out of COVID outbreak homes, and what infection control measures are put in place to do that safely?
Cabinet Secretary.
So I don't have the answer to the first part of Mr Cole-Hamilton's question. I'm not sure if it is possible for me to acquire those numbers, but I am certainly prepared to undertake to consider that and look and see if we can, and let Mr Cole-Hamilton know that. The second part of his question, though, is really important, and that is infection prevention and control measures. All care homes at all times, pre-pandemic and since, should have adequate infection prevention and control measures in place. We all know that every winter our care homes suffer from norovirus to varying degrees, that flu is part of seasonal activity in winter, and the older residents are particularly vulnerable to both of those. So all care homes should have very, very clear and updated infection prevention and control measures. But in addition, in terms of the current pandemic and the current situation, of course, the guidance that was issued on the 13th of March was very clear, and every piece of guidance subsequently has been very clear. The current work that is underway about isolating individuals in their own rooms if they have symptoms or they have come from a COVID-19 setting, in order to ensure that even if they had tested negative, we do that for the 14 days to be sure that no symptoms do emerge. Growing knowledge about the range of symptoms, particularly in older people that are there that appear to differ from those of a different age group, as well as all that guidance about the ending of communal activity, communal dining and so on. And now, in recent weeks, the direct involvement of our Directors of Public Health and our NHS clinical teams in ensuring that all those care homes are practising the requirements that have been theirs to meet for some considerable time. And as the member will know, the Care Inspectorate is undertaking a number of inspections of care homes across the country, on-site visit inspections.
Thank you very much. Question number 3.